This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hello friends, I'll be speaking about cataract management in a patient who has got severe kyphosis. Now this is an elderly gentleman who cannot lay flat on the bed because of his skeletal problem, and the challenge really is that the position of the head is very much high and it's extremely difficult for us to operate on him. So some of the strategies which we use in this patient I would like to highlight. The first thing would be to make the patient comfortable. So we had to provide him a hard support under his neck so that it can be stable, and these are some of the stuff which we used. Placed a box and used the packs which are the cassettes. So ultimately we could raise the level of the supports for about 1.5 feet from the actual head level of the table, and this ensured that the patient could lie down. Now he could move his chin up, that's not an issue. The only thing was, with this height from the chair, I couldn't sit and operate. So I had to decide that whether I would like to stand and operate, and should I do a manual SICS or a phacoemulsification. So manual SICS would be easier because we are not going to use any foot control. But phacoemulsification, my one foot at least has to be always on the foot pedal. So I was wondering whether it would be any difficult. Cataract itself was not very challenging. It was a routine case. People were dilating, moderately dense cataract. So cataract was not an issue. So I thought I'll still go ahead and do a phacoemulsification. The microscope is set. So the strategy is my left leg is going to support me while doing the surgery, and I'm not going to use the microscope foot pedal at all during the surgery. And my right leg is going to be on the foot pedal of the phaco machine, and this is going to do the control. So surprisingly, I found that it was not very difficult at all. So the patient was reasonably cooperative. I did not use the microscope foot pedal at all. And with one leg I could support myself, with the right leg I could control the phaco machine as routinely as it could be. So this is how the look was. I'm standing here, my assistant is helping me out, and the patient is comfortable. So we lifted his legs up as well, that could make him more comfortable. and this is how he's walking up for the next day checkup, and he's doing fine. Well, to summarize, in these kyphotic patients where the neck level would be significantly higher and it may not be possible for us to do the surgery sitting down just because of the height at which we're going to operate. And in these situations, standing up and doing phaco is a reasonable option. And so I realized that standing and using only one leg to support you and the other on the phaco foot pedal is not a big thing. It can be easily done. It was no different from operating me sitting down. So that was it. Thank you for watching and hope you found this helpful.